Great. Well, Jo, should we make a start? I know Geraint's not with us just yet, but in the interest of time and understanding the Minister's schedule. So on behalf of Geraint Davies MP, who will be joining us shortly and is the chair of the All-Party Parliamentary Group on air pollution. So just while he gets here, just to welcome everybody, to wish you a very happy Clean Air Day. And thank you very much for joining this meeting. This is a special APPG to mark Clean Air Day, which, as you know, is the largest air pollution campaign in the UK. And today the Clean Air Day's theme this year very much is about the whole body harms of air pollution, acknowledging that air pollution isn't just a lung health issue, but can get into the bloodstream, go throughout the body, and dirty and harm all of our organs. So we have an excellent group of speakers here today, academics and health professionals who will tell us just how bad air pollution is for us. The Minister will then have an opportunity to respond, and we'll also be sharing some tools and tips for especially how the health sector can help people to understand and act on the health harms of air pollution. Geraint, I'm afraid I started just because we wanted to move things on, but if you want to say a quick hello before we go into Stephen, please do.
Yeah, I apologise for slight delay of technical issues. My name's Geraint Davies MP. I'm the APPG chair for air pollution, and also just add my welcome. We're going to hear from the excellent Stephen Holgate in a moment, and also, as has been said, Jo Churchill will be joining us. A lot of our focal points have been about trying to urge the government to be more ambitious in the consultation DEFRA has put out to meet various targets, in particular PM 2.5, 10 micrograms per cubic metre by 2030 as opposed to 2040 as a guiding light. And as you'll know, research has been done by Imperial and King's to suggest this can be delivered. There's been some suggestions there might be a couple of industrial exceptions, but I'm sure we can push forward something a bit more sophisticated. I guess what we're saying loud and clear, as we always do, is there's something like 62,000 deaths a year at a cost of £20 billion. If we just reduce the cost to 17 billion and say 3 billion a year, the government could basically service a debt of something like 300 billion pounds in green investment and the like. Obviously, part of this is to move towards a new industrial energy strategy where we use renewables and have hydrogen and electric cars. And I thought I'd just mention in passing that in Swansea University and elsewhere, in fact, there's some groundbreaking research whereby instead of the renewables for wind energy and solar and the like, have just used at peak times to feed into the grid when it's most needed. A lot of this renewable energy isn't used during the day, and that should now be fed into producing hydrogen that can then sort of basically feed hydrogen cars, transport, and also blend into the gas to reduce the carbon footprint. But there's lots to discuss. So without further ado, perhaps I can invite Stephen Holgate to say a few words. Over to you, Stephen.
Yes, thank you very much, Geraint, and good morning, everybody, on this Clean Air Day. Bright and sunny, I think, across the United Kingdom. And not sure whether we've got an air pollution episode at the moment, but this is the sort of weather we do tend to see accumulation of air pollutants in our atmosphere that we're all breathing. Well, look, this meeting really is to try and highlight some of the sort of new areas of research in the field of air pollution and human health. I think one of the things, if I could have the first slide, please. I think one of the things that we have learnt in the last 5 or so years is that in addition to the lungs and the cardiovascular system, air pollution has an effect on every single organ of the body. And not only that, but it operates across the entire life course from conception to the moment we die. And so it's a serious health issue. In fact, it's the most serious of the environmental insults that we have to bear on human health. And that's why it is an urgent, there is an urgent case for action, and action now. The reason we think action's needed now is that the health effects that we're going to be discussing today are occurring at concentrations far lower than the current limit values that most of our people are informed with. And of course, we're operating under the EC limit values at the moment. but it's the World Health Organization limit values, and particularly the revised figures that came out in September 2021 that we want to aim towards, to try and focus the attention on human health and to improve human health by orders of magnitude. And the reason why we need to do this is that this particular area of environmental insult accelerates the progression and in some cases initiates the non-communicable diseases that are filling up our National Health Service and our hospitals at the moment. Moreover, all of these effects are increased in the disadvantaged and the most susceptible. So there's a social imperative as well as a medical one to get on and sort this out. So without further ado, can I please hand back to you, Geraint, and you may wish now to introduce the various speakers. Thank you very much indeed.
Thanks so much, Stephen. That's terrific to underline the increasing and wider impacts on human health and the need for urgency. Could I now invite Dr. Mark Miller, the University of Edinburgh Centre of Cardiovascular Science, to talk about the impacts of air pollution on heart health. Over to you, Mark.
Okay, good morning, everyone. Thank you very much for having the real privilege to speak today. So, as introduced, I'm Mark Miller. I'm from the University of Edinburgh, and for more than 15 years now, I've been researching how air pollution affects our cardiovascular system. So that's our heart, our blood vessels, and our blood. Could I have the next slide, please? And maybe one more as well. Great. I'm hoping that's coming up. It's a bit slow on my screen, but hopefully you can see that now. So this is a really difficult subject to cover in just 8 minutes. So what I'm going to do today is just pick out a few sort of key points as to why the cardiovascular effects of air pollution are so important. And perhaps the things that gets the headlines and the place that's probably best to start is the early deaths that are linked to air pollution. So if I can draw your attention to the left of the slide here, I'm going to show you some data by an old study, but a classic one that was done in 1993 called the Six Cities Study. And you might be able to see on the map here, the reason it's called the Six Cities Study is that the investigators took 6 cities in America with similar sort of demographics, but they had different levels of air pollution. And what they did is they had a look at the death records in these different countries. So if you look at the lower left, what you can see in this graph here is there's a graph with lots of different letters. So each letter is the name of the city that they studied. And you can perhaps see that all these different cities have different levels of particles in the air. And I'll touch a little bit more on why particles are so important. But they have different levels of pollutant particles in the air. And you can see there's a really clear link between the amount of particles in the air and the risk of dying of a lung and heart disease. I should also say that the investigators carried out really complicated statistical analysis, and this is to try and rule out other risks that might be causing this, such as smoking. So this graph here is looking at lung and heart diseases, but the middle graphs I'm going to show you are looking at worldwide data at different causes of deaths that are linked to air pollution. So the bars you can see, particularly the one that's 2015, this is the number of deaths which are linked to air pollution across the world on an annual basis. So you can see that there's more than 4 million deaths are linked to, this is outdoor air pollution. And in fact, when you combine it with other types of air pollution, we're looking at about 7 to 9 million premature deaths every single year. You know, this is vast quantities of mortality that are linked to this. But I've tried to highlight the region here, the different colours, and those colours give you an idea of the cause of the death. And the pink and grey colours, they are deaths that are caused by cardiovascular disease. So more than half of the deaths that are linked to air pollution are due to cardiovascular disease. And to be honest, I could spend more than about 20 minutes offering you very similar shocking statistics. You'll be pleased to know I'm not going to do that. And just on the right hand side, I know you can't read it, but there's an example of an infographic that's provided by the World Heart Federation, and they can give you some list the very, very shocking figures that we see in relation to air pollution and cardiovascular disease. And it's also worth mentioning as well that the WHF have a policy brief that concisely covers the issues, and it gives recommendations for the various different target audience, including policymakers. Next slide, please. So just looking at cardiovascular deaths, it doesn't really give you the whole picture. So what I've tried to do in this slide is I want us to look at a timeline of our lives. So this is from the womb to the tomb, as the phrase goes. And what people tend to think of when they think about air pollution is there's a spike in air pollution that has an immediate effect on our body. So for example, on the left side of this bar, maybe it's causing an asthma attack. Or on the right side of this bar, if you're someone who's elderly or you have a health condition, that this exposure to air pollution causes a serious problem that causes death. And these are all reasonable assumptions, and in fact this is exactly the sort of things that are measured by scientists looking at how air pollution affects health across populations. Next slide, please. But actually, that's a huge oversimplification, and our exposure to air pollution is much more like this. So what we have to remember is we are continually exposed to air pollution throughout our lives. And yes, there's variations in that, there's spikes of air pollution every so often, but we are continually exposed. And in fact, we're even exposed to air pollution before you're born. So you can see there's a few flashes above the image of a baby on the left. So what does this continued exposure have on our bodies? Next slide, please. So essentially, this continuous exposure will be continually affecting the way our body functions. And an analogy I tend to use is that air pollution is in fact slowly making our bodies rust. It's having this continuously damaging property on our bodies. And this sort of damaging property essentially makes us more likely to develop diseases and speed up the diseases we already have. And cardiovascular diseases, I think, are some of the ones that are the major ones in my opinion. So we're all born with cardiovascular disease to some extent, or the early signs of cardiovascular disease, and it develops over very many decades. But it's only when it gets really bad enough do we notice, when we have a serious consequence like a heart attack or stroke. And bear in mind that the number one cause of death in the UK and elsewhere in the world is cardiovascular disease. And it also has a huge effect on our health, our lives, and the economy. Okay, next slide, please. So with support from the British Heart Foundation, we've been studying how air pollutions cause damage to the cardiovascular system for a long time. And I'm going to give you one example here, and this is an example that really sort of sticks in people's memories. And that's because it's looking at how diesel exhaust, which is one of the most important air pollutants, affects the health of, affects the cardiovascular system in humans. So we collaborated with researchers in the Netherlands and Sweden, where they carried out controlled exposures to diesel exhaust in volunteers. So on the left side, you can see an idling diesel engine that runs through pipes, and then it runs through to the right picture where we have a volunteer who's cycling away within a chamber. So probably the first and most important thing to say here is that the diesel exhaust is diluted down. So this box doesn't fill with black smoke. What we do is we set these levels to whatever we want to look at. And in most of our studies, we have a person who's exposed to 2 hours of diluted diesel exhaust at a concentration that you might find in a heavily polluted megacity, or for example 2 hours of cycling in very close proximity to heavy traffic. And then after this, the volunteer would go to our clinical research facility and we can study how the exposure affects the cardiovascular system. And I'm afraid within the time, I can't show you all the nice graphs we've got to do, but I can summarize it. Oh, sorry, next slide, please. And the way I would summarize it is just these relatively short exposures of environmentally relevant levels of diesel exhaust have many effects on our cardiovascular system. So they alter our blood clotting, they make our blood more likely to clot, they make it harder to get rid of clots. The pollution alters the rhythm of the heart, it makes it more susceptible to damage. And it also stiffens our arteries, it makes them more sluggish in the way they control the flow of blood around the body. And essentially all these short-term effects are going to make a healthy person more likely to develop cardiovascular disease. And if you already have cardiovascular disease, it's likely that you're more likely to have a serious clinical event. Next slide, please. So I'm conscious of time, so I'm going to try and speed up a little bit. But I just want to say that this is not just effects that we see and we don't understand them. We now have a really good understanding of how these different pollutants can affect the cardiovascular system. And in particular, the tiny particles are the things that worry me. And when we talk about diesel exhaust, we talk about very minute particles called ultrafine particles. And these are particles that are smaller than viruses, so they can pass from our lungs into the blood, where they can be carried to the different organs of the body. And again, I'm not going to go through this in any detail, but we've done exposure studies where we can actually ask people to inhale particles. and they get into the blood, and they actually stay in our blood for a very long period of time, more than 24 hours. And in fact, when we invite these volunteers back 3 months later, we can still see these particles in the blood, even at 3 months afterwards. And probably the last important point, which is down at the bottom right here, is that these particles don't just get into the blood, they go to areas where they can cause harm. So we managed to show that these particles actually get into bits of vascular disease, into diseased tissue. And these are the places that they will really aggravate the condition and make the health condition worse. So it's almost as if these particles are designed to reach and target the most susceptible areas of our body. I'm not sure how I'm doing for time. So this is quite a busy slide, the next one. The next slide, please. So I'm perhaps just going to skip through it. But today I just wanted to remind everyone, this is looking at how air pollution affects different organs of the body. So let me just say that the cardiovascular system plays a role in all the other organs of the body. I mean, after all, the blood vessels deliver blood to every organ of the body. And we've done lots of mechanistic studies, and there's lots of evidence out there that shows that the cardiovascular effects of air pollution will have effect in different organ systems. So it will have effect on the blood vessels of the brain, making you more likely to have a stroke. It increases blood pressure, that puts stress on the kidneys, makes you more likely to develop kidney disease. The exposure to air pollution alters the blood vessels in the placenta and potentially could affect the way blood is delivered to the unborn baby. Blood vessels, of course, feed cancer tumours. Also, we have circulating cells within the body that then help repair our bodies, and it's been shown that pollutants like diesel exhaust change these cells. And there's now really clear links to conditions such as obesity, metabolic syndrome and diabetes, which are essentially an epidemic in most countries now, and cardiovascular complications are one of the major causes of deaths in those cities. Next slide, please. So lastly, I just want to finish on a slightly more positive note, and just to say that while there's still a lot of research to be done, we do already know the way to tackle air pollution, and that's principally don't make it in the first place. So I won't go through the slide, but just to say that if we can change the way we travel, that we can change the design of our cities, our education, even our diet, you can reduce air pollution, and especially when these are combined together. But what we really need is a drastic acceleration of our efforts to make them effective. And next slide, please. And I just wanted to finish on this slide here. So this is an example sent to Environmental Protection Scotland, who are leading Clean Air Day in Scotland. And this is a photo of 4 pupils in Glasgow, just outside the low emission zone, showing a new electric bus and learning more about air pollution as a school project. And I want to finish on this as a great example that change is happening today. And hopefully there is a promising future where we can get rid of air pollution and improve the health of our hearts. Okay, right. I'll stop there.
Okay, Mark, that was absolutely fantastic. Thanks so much. And of course, the 6 cities analysis was done in 1993, and it is now moved to have estate agents putting levels of air pollution outside people's houses. And I do hope we can sort of bring this forward, because if cities and individuals think that air pollution is impacting on their health and their house price, etc., that will be another driving force for change. We need to solve some of the problems we just heard. Now, without further ado, Emilia Lim is from the Francis Crick Institute and is going to focus on cancer. Over to you, Emilia.
Thanks very much. Thanks everybody for having me today. If I might have my first slide. So I'm Emilia. I'm a postdoctoral research fellow in Dr. Charlie Swanton's lab at the Francis Crick Institute. And in our lab, we're very interested in studying lung cancer. So how lung cancer initiates, how it develops, how it evolves over time. And we are really interested in tracking these patients before diagnosis, at diagnosis, through time, to understand what are the genomic, environmental, microenvironmental underpinnings of this disease. Next slide. And among this, like, my personal interest is actually in lung cancers in never smokers, which is a growing public health concern. If you consider it as a separate entity, it is actually the 8th most prevalent cause of cancer death in the UK. So even though most people think of smoking when they think of lung cancer, there's actually quite a few lung cancer cases, about 15 to 20% of them, they're actually occurring in never smokers. And this is a huge concern because 85% of people in the UK do not smoke. Next slide, please. So when we think about lung cancers in never smokers and compare them with smoking lung cancer, we see that they're quite biologically distinct. And so this is where our research begins. So here I have a plot showing the numbers of mutations in lung cancer tumors, and they're just sorted from the most to the least. And you can see on the right-hand side of the plot are the blue ticks that represent the never smokers. And you can see the tumors from the lung cancers in never smokers tend to have much fewer mutations than those from smoking lung cancer, suggesting to us that it's not really a mutation, not as mutationally driven, and there might be sort of a different biological underpinning for why there's such an initiation in these cases. Next slide, please. Also, when we look at the geographical bias of lung cancers in never smokers, we see that there tends to be a higher incidence of lung cancers in never smokers in Asia with a younger age of presentation. But again, the explanation for this is unclear. Next slide, please. So if it's not smoking and if it's not heavily mutation driven, what we think about other risk factors that could affect this patient group. So could it be the environment, residential radon, cooking oil vapors, indoor coal and wood burning, inherited genetic elements or viral factors? These are all things as researchers we are considering about what might impact this patient group. Next slide, please. But one of the big hypotheses we have in the lab right now is, could air pollution be playing a role? This is because most people live in places where air pollution levels exceed WHO guidelines. So over here is a world map showing PM 2.5 levels in every country. And you can see that most of them are, I think 99% of them are above the WHO guideline in 2021 of 5 micrograms per meter cube. In the UK, the air pollution is relatively low compared to the rest of the world, but you do see that in Asia, the pollution levels can get quite high. So this led us to think, about the lung cancers in never smokers, which are more prevalent in Asia, where the pollution is higher. Could there be sort of a link? And that's sort of got our minds thinking about this. On the next slide, I have another sort of pollution map. Next slide, please. Next slide, please. Just showing pollution levels across England. And this is data from DEFRA. And you can see that there is quite a range of pollution, even though it's lower than the rest of the world. But within urban areas, the pollution can get quite high. I zoom in here on the right-hand side on Greater London, and you can see in bright yellow where the highest air pollution levels are, where the motorways are. And right in the center, the brightest yellow spot is Central London, where our research institute is located. So this is definitely a problem that is close to home and close to our hearts. Next slide, please. So looking back at some statistics then, air pollution was estimated to have contributed to about 265,000, so that's 14% of lung cancer deaths in 2017. And this is second only to tobacco smoking. And since there are a lot of smoking cessation programs that have already begun, there are actually fewer smokers over the years, and this means that actually the proportion of never smokers is increasing, and the proportion of cancers then that might be attributed to air pollution is also increasing. Next slide, please. However, as scientists, we realize that the effects of air pollution are poorly understood. We don't really know how air pollution is actually causing cancer or actually doing damage in our lungs to trigger tumor initiation. We know that there's an epidemiological association, but we still don't really understand if the pollution is causing DNA damage in a certain way. Is it causing inflammation? Are there specific gene expression or protein expression programs that might be disrupted? Are there metabolic pathways that are disrupted? And all of these things are open questions that we are really trying to investigate to better understand what air pollution is doing. Next slide, please. So in our lab, we're very interested then in looking at lung cancer from the point of studying human lung, normal lung tissue to try and understand this. So we have been able to get normal lung tissue samples from 2 sources. First of all, at lung cancer surgeries. So shown on the left is a picture of a lung sample obtained from a lung cancer surgery where the tumor is right in the middle, but on the top left corner, you can see that we have an adjacent normal in which we can use to profile for mutations, microenvironmental changes, carbon deposits, etc., to see how air pollution might have impacted a lung. So we compare regions of people who have lived in regions of high air pollution versus those who have lived in areas of low air pollution to see how these different characteristics might be different across different geographical regions. On the right-hand side is a sample taken at autopsy. So these are from patients actually who never get lung cancer in their lifetimes, but may die of a different cancer. So these are normal lungs of people who don't get lung cancer, but are still impacted in some way. So here in this particular picture on the right-hand side, that's a normal lung taken from a lifelong never smoker. But if you look closely, you can actually see that there are all of these black little dots on that lung. They're actually carbon deposits that could be attributed to pollution. So this is an area of our interest. We're trying to understand for those areas with a high level of carbon deposits, what's actually being disrupted there, and can we better understand what air pollution is doing, so we might find ways to mitigate any sort of damage or cancer-inducing mechanisms that air pollution might cause. Next slide, please. So our lab's just interested in lung cancer for now, but we're really thinking more broadly in the future about how air pollutants could end up throughout the body. You've heard from the previous speakers that there are so many different organs that may be impacted. From our lab, we're having early data showing that there's an association between PM 2.5 and brain cancers. We have a collaboration in a neighboring lab where they're looking at whether ingested PM 2.5 might affect gastrointestinal cancers. So this is an area of research that's actively gaining popularity, and it's of crucial importance that we continue to do this work. So this leads me to my next slide, where I just say more research is needed to study air pollution from different cancer types. And finally, on my next slide, what are researchers like us doing about it? We're asking questions about how air pollution causes cancer and what happens to the underlying biology when air pollution comes into play. And ultimately, we want to find out how we can best detect, treat, and prevent cancers that may be associated with environmental pollution. Thanks a lot.
All right, that was absolutely brilliant, Emilia. And it reminded me, I've got to say that the 2 years I've spent working remotely in Swansea instead of London has probably extended my life expectancy. But anyway, moving without further ado to Dr. Tom Russ of the University of Edinburgh, who's going to now focus on the impact of air pollution on brain health and dementia. Over to you, Tom.
Good morning, and thank you very much for the invitation to speak today. I'm delighted to be here, though of course we're all at home, which is the bizarre world we're still living in. Could I have the first slide, please? So my name is Tom Russ. I'm a consultant psychiatrist in the NHS, but I also have the privilege of being an academic at the University of Edinburgh. As you've heard, I'm going to talk about air pollution and the brain today. So if I could have the first slide, please. So this is really to acknowledge one of the groups which excel at covering this work, which is a group at the University of Southern California at Los Angeles called the Air Pol Brain Group, who have really led the way in the influence of air pollution on the brain. They combine epidemiology and fundamental science in a very innovative way. And a few years ago, in the journal Science, Emily Underwood, the journalist, wrote a wonderful, accessible article about their work and about the field, which I'd highly commend to you if you want to have an introduction to the research here. If I could have the next slide, please. So air pollution is of growing interest, but air pollution of the brain particularly so. This is just a very quick search of the scientific literature, looking at articles which include the phrase air pollution and brain, and you can see that in the first decade of the 21st century there was a little interest, but not very much. But certainly it takes off, and it's just increasing at a rapid pace. It's an area of great interest, though, as I'll show in a moment, maybe a lot of the research hasn't been necessarily shedding new light on our understanding. If I could have the next slide, please. And I hope I haven't been too clever by half and that these animations might work. So on the left here, this is to show you how small these particles are that we're talking about. So the purple circle is a human hair. And if you could have the next slide. This is the blue circles are PM10, so particles that are very small, PM2.5 even smaller, and the in brackets it suggested some of the common sources of these. And then one more click, please. If you can see the tiny white dot in the middle, in the middle of the third red circle, that's how small an ultrafine particle is. These particles are really, really tiny, so no wonder they get everywhere in the brain. And on the right-hand side is a schematic which really highlights that there are likely to be direct and indirect effects on the brain. So direct effects on the brain, but also indirect effects, particularly inflammation coming from the effects on the lungs. And I really take my hat off to my colleagues who work in air pollution and cardiovascular disease, and Mark in particular, because we have a really good mechanistic understanding of how air pollution affects the circulation and the heart. We're not quite in that position with the brain, but we are rapidly moving towards it. If I could have the next slide, please. So I said that air pollution particles can make it into the brain, and a few years ago this chilling article proved it. So if you think back to your GCSE or O-level chemistry and remember about the different ion types, so we've got magnetite and hematite, these two particles you can see here, the one in the red circle and the white circle, are both magnetite. But their configuration is different. The one on the left is very smooth and round. The one on the right is knobbly. The one on the right was probably formed within the body in human physiological environment. The one on the left, because of its shape, we can infer it was most likely formed at an incredibly high temperature, probably in an internal combustion engine. And so this is an external particle of air pollution which has found its way into the brain. We don't fully understand the consequences and ramifications of that, but the fact that air pollution gets into the brain is of a concern, and I'll explain why on the next slide. So when you're at medical school, you learn about the thing called the blood-brain barrier, which is supposedly this impermeable protective thing that stops anything bad from getting into the brain. And as I've progressed in my career and understanding the brain, I've learned that it's just not as good as we were taught in medical school, sadly. Things get through it, drugs get through it and have bad effects on the brain, but also, as we've seen, particles get through it and have their effect on the brain. And one of the possible areas is just behind the nose. There's an area of bone called the cribriform plate, through which nerves come, and it's possible that the particles get in through there, either through holes in the brain or actually translocating up through the nerves. But again, this is an area of development, but we do know that air pollution gets into the brain. Next slide, please. Mark has already covered wonderfully the issue of the fact that the whole of the life course is important in terms of determining risk. And this is a wonderful study from Iceland where they demonstrated something similar for the brain. And this figure summarizes some of the influences on brain and cognitive development over the life course. And they demonstrated that the birth size was related to performance on cognitive tests 70 years later. So what happens in the womb affects your cognitive aging. This is something that has only really come to light in the last decade or so, but is a really exciting and important area that shows actually how far back we need to be looking. So if I could have the next slide, please. This is the animation I'm slightly worried about. This is from the 2020 Lancet Commission report on dementia prevention, intervention and care. It is a fantastic state-of-the-art document summarising where things are. In fact, I realise I've put in the figure from the previous one, which doesn't. No, this is the air pollution one. Sorry, this is the 2020 figure. So the innovation that they made with their initial report was dividing risk factors into the area, the period in life when they have their greatest effect. And we can see here that about 40% of dementia risk is potentially modifiable. The remaining 60, the genetic effects probably less so, but some remains unknown. But they've included air pollution in one of the risk factors for later life. The 2% is the population attributable fraction, so that really implies that if you could eradicate exposure to air pollution, you would probably get rid of 2% of occurrences of dementia. And if you can click, hopefully we'll animate and go down to show the rest of the picture. Excellent. So these are the things that are important in later life, and you can see that air pollution is up there with the best of them in terms of its risk. If we could have one more click, please. It's a very long figure, which PowerPoint doesn't really like. And there are other risk factors which are important in midlife and other ones in early life, including, importantly, lower education. So if you could have the next slide, please. So a few years ago, a few of us got together and examined the literature critically and found that so much of it is a variation on a theme, really. It's looking at relatively recent exposure to air pollution based on one instance of residential address and linking that to dementia or some other outcome at about the same time. Whereas we've seen from the life course approach that the Iceland slide showed us that really we need to be thinking much longer term. And so we came up with 3 questions that I think still haven't been adequately answered, but are really crucial ones as far as I'm concerned. Number 1, when in the life course is exposure to air pollution the most important? We know it's probably bad for you. I'm not aware of any study that's looked at air pollution in the brain that suggests that it's not harmful. But when in the life course is it most bad? Is it in midlife when the brain changes of Alzheimer's disease are developing, or is it in late life when those brain changes might become overt and become symptomatic dementia? Which pollutant or components are most important? We've heard a lot about particles. There are also gaseous pollutants. We're not really sure which is the most harmful. And finally, since dementia describes a heterogeneous group of conditions, and we've used a broad umbrella term here, brain health, what's the most important aspect of brain health that's most affected by air pollution? Does it affect everything or just some aspects? So if we could have the next slide, please. So one small step that we made towards answering this question was through a grant that I'm very grateful to acknowledge the Natural Environment Research Council support for, which was looking at historical air pollution. We don't have measured air pollution going back more than a few decades. But if it's likely that it's very early in life when exposure to air pollution is important for brain health, we need to find out what things were like then. And my colleagues at the Centre for Ecology and Hydrology are absolutely fantastic and used big brains and even bigger computers to model historical air pollution levels for 1935, which is when an important cohort study, the Lothian birth cohort study, will have been in the womb, using historical emissions data and extant meteorological data, and as I say, a very big computer. So the map that you see on the left of Scotland shows modelled air pollution concentrations, PM2.5, in 1935. And you can see that the majority of Scotland, as is the case now, having just been on holiday in the north of Scotland at the weekend, the air quality is very, very good. But you can very clearly see the large urban centres, and on the right-hand side you can see an enlarged area of the central belt where the majority of the population of Scotland lives, and you can clearly see Glasgow and a slightly lighter shade of orange, Edinburgh, on the right-hand side. The reason we use the Lothian birth cohort is for 2 reasons. One, that we have residential history across their whole lives for about 600 out of 1,000 participants, because we asked them to list where they'd lived throughout their life and gave them some prompts like the Falklands War and other things to think about where they lived when. And so we can link it to air pollution available at different periods of history. But we also have IQ intelligence tests of them from at age 11, which is a unique resource apart from the previous Lothian birth cohort and Aberdeen birth cohort, who a group 15 years younger who were tested born in 1921, tested in 1932. But also we have them retested. So from the age of about 70 onwards, we've been seeing them every few years, retesting their IQ, scanning their brains, all sorts. And we're in the middle of the 6th wave of follow-up at the moment with them in their middle 80s. So we can link the exposure to air pollution that they experienced in the womb to what happened subsequently. And we know that higher exposure to air pollution in utero, so 1935, was associated with worse cognitive change between the age of 11 and the age of 70. So very early exposure to air pollution has a detrimental effect on the brain that lasts a very, very long time. We now have, through the enormously hard work of my students and NHS colleagues, have ascertained for every one of the cohort who's developed dementia and who hasn't. So we're going to do something similar using dementia as an outcome rather than intelligence. So I'm very excited to see the findings of that. But this is a step forward in answering the question about when in the life course is it most important to be not exposed to air pollution, ideally. If I could have the next slide, please. So finally, just to summarise, you've already heard said much more eloquently than I could that air pollution exposure is very, very common, but we do know that particulate matter gets into the brain. It's likely there are direct and indirect effects on brain health from air pollution, perhaps from the particles actually in the brain, but also inflammation and other things, and the effect on the cardiovascular system, on the circulation to the brain. Every study suggests that air pollution is bad for the brain. There are still questions that we need to answer in more detail. There are still areas that need to be explored, but this isn't an area where the literature is mixed. But it's really important to remember that dementia is a disease of the life course. It is not a disease of later life. It manifests in later life, but the brain changes start decades before the symptoms start. And there's emerging evidence that early exposure to air pollution may be important. It's not to say it's not important later in life as well, but early exposure could be very important for the brain. So thank you very much indeed.
All right, Tom was absolutely brilliant. And one of the things that stood out for me, I've got to say, is that the fact that ultrafine particulates are much more damaging. So obviously, if you had 10 micrograms of PM2.5 versus 5 micrograms of ultrafine, the ultrafine would be much more harmful to the brain, hence the concerns people have about the doubling of incineration in urban centres, where ultrafine can get through the filters. Now, without further ado, Larissa Lockwood from GAP, Tools to Help Protect Patient and Public Health from Air Pollution. Larissa.
Thank you, Geraint. Yes, gosh, after that really shocking but also motivating set of presentations, it falls on me to sort of provide some hope and action. And I guess this is precisely the issue that we're facing. Air pollution is so bad for us. We have to get rid of it because the damage starts right at the beginning. And I'm sad to learn that my blood-brain barrier isn't protecting me. That is something I learned and was carrying with me. But actually, I believe the minister's just arrived, so I'm going to stop speaking and we'll go back a slide, if that's all right, Geraint. And
of course,
Mr. Speak, and I'll come back to the hope piece later on.
Okay, welcome, Jo. Over to you. Jo Churchill, Parliamentary Under Secretary in charge of air pollution, public health. Are you there, Jo?
Yes, I'm here. Sorry about that.
Welcome.
I am. Thank you very much indeed, and happy Clean Air Day, everyone. So let me first of all just start by expressing my thanks to everybody who is involved, to you and to the whole APPG for the work that you do, which is so important to making sure that we drive things forward. I'm sorry that I can't stay for today, but later on you'll hear what I'm doing, so I hope you will understand. And I'm sorry to have missed those the speakers so far, and I would be really interested in seeing the slides. And then finally, thank you to Larissa and the GAP team for their hard work on making this year's Clean Air Day the success that I know it will be, but also arguably trying to make every day a Clean Air Day. Now, we're committed to protecting people from the dangers of air pollution alongside driving down emissions and concentrations of harmful pollutants to their lowest levels since records began. But actually, we know this is complex, we know that it's hard, and we know we have to go faster. We also know we have to engage the public. There's a need for this to be an ongoing dynamic conversation, and to help them better understand air pollution and its effects. The tragic death of Ella in 2013 brought the whole area and the importance of it into sharp focus. And tomorrow marks a year since the government responded to the coroner's recommendations following Ella's death. And in that time, I hope you will agree, we have started to take a range of significant actions. Now, one is the establishment of a bespoke new group to comprehensively review how we communicate air quality information. The group includes experts in air quality, public health, behavioral science, and communications, as well as representatives from vulnerable communities and the public. We talk to them regularly to make sure we get real-time information. And I have tried to also make it my job to, whenever I meet with people, to use those meetings to raise air quality. I have done with Jenny Harris, who leads UKHSA, and I have done with Nikki Kanani, who leads the GP group for NHS England. It's really important that we do this together. I've also drawn a group of ministers from across government because this is an area where we need to work together. So there is both ministers from DULUC, Department of Transport, BEIS, and ourselves working together and health to make sure that we can really tackle this. Now, our aim is to ensure that members of the public and vulnerable groups in particular have better information to protect themselves and understand air quality. Now, given the title of today's events, I also wanted to mention the work that is ongoing with health professionals and their organisations to consider how we better communicate the information. I recently had a good session with Kate Langham from Guy's and Thomas's, and making sure that everybody is joined up here is really important. Now, building on the London Air Quality and Health Summit that I joined earlier this year, I also know that Chris Whitty, the Chief Medical Officer, is closely involved in this work as well. Now, as you know, that we passed last November, the Landmark Environment Act, under which we will set 2 new air quality targets with the key focus on maximising improvements to public health. Now, in order to drive up clean air for everyone, alongside our annual mean concentration target, we are proposing an innovative population exposure reduction target, or PERT. This will support continuous improvement even where concentration targets have already been achieved, because this shouldn't be a target like a speed target that we aim for. We shouldn't be aiming for 10, we should be aiming for 1 or 0. And pulling concentrations of PM2.5 below 10 milligrams per cubic meter, where locally relevant, is really important. So as a result, on average, people's exposure to particulate matter will be cut by over 1/3 by 2040, compared to 2018 levels. Now, 35% reduction is really ambitious, but I intend that we focus on it and we get there, because achieving our targets will contribute to a reduction of many tens of thousands of cases of cardiovascular disease, strokes, asthma, lung cancer over the course of 18 years. And I know that, there is also ongoing research into how particulates also affect the brain and another suite of illnesses and disease that affect people. We won't wait till 2040, because under the Environment Act, it is necessary that we report on progress every year, and we will have a continuous improvement driven by interim targets. And through our target consultation, we've heard a wealth of views from stakeholders, and I'm really, really grateful for the diversity of valuable information that is brought together. That's why Clean Air Day, the UK's largest air quality public awareness campaign, is so important, because it brings people together on this vital issue. Now, I'm proud that DEFRA has supported GAP to run Clean Air Day since its inception back in 2017, and we look forward to continuing to work in close partnership with NGOs, charities and academics going into the future as we take further action on air quality. Now, in keeping with this theme, I am going to Marylebone later on to visit an air quality monitoring site. I've been convinced to cycle there. I'm not sure how successful that will actually be. Me on a bike in a city is very different to the areas I usually cycle in. So I'm looking forward to both the discussion when I get there, but also navigating London traffic on a bike. I also later on this morning, and I think Stephen's with you this morning, I've got a discussion on public awareness later on with DEFRA's permanent secretary Tamara Finkelstein and Professor Sir Stephen. Now, I hope today's discussion will be useful, and I would ask you to talk to not only your colleagues, but everybody you come into contact with, your families, your friends, your patient groups, anybody, and consider the changes we can all do to improve air quality. Some of the issues, particularly around things like domestic burning, aren't easy to deliver. So the more of a conversation we can have about these things, the better it is for those of us who actually want to make sure that we can deliver on those targets. So thank you for having me. Have a good Clean Air Day. And I wish you all the very best with the work that the APPG is doing and the work that GAP, Rosamond and other people who are vital in this area are continuing to do. Thank you.
Well, that's fantastic, Jo. Thank you very much for your time. Are you willing to take a question or not?
I am so sorry. I got this invitation quite late.
All right. No.
To 10 o'clock.
Okay. Well, in that case, maybe
I am happy to come, and you've got lots of great speakers.
Yeah, well, maybe I can just make a quick comment, but very quickly. One is that we've recorded the presentation, so we will be sending you those so you can look at those when you've got a spare moment. Secondly, I guess we welcome the monitors as a way of increasing sort of public awareness and therefore support. Obviously, we'd like to amplify what Chris Whitty finds, and we would urge all departments to get involved. In particular, the Department of Transport isn't sort of involved in air quality zones in Manchester and the like. But obviously,
I work very closely with Trudy, and of course we have the Joint Air Quality Unit that is shared between the departments, and that cross-government but cross-departmental working, I think, is absolutely vital, Geraint.
Yeah, so the more we can have that, the more they report back as well on what the different departments are doing, because we appreciate all the levers aren't in your hands and it needs to work together. So anything we can do together to do that, we will. And indeed, I think we're going to get involved with the Royal College of GPs to help promote the line that obviously this, air pollution is a silent killer. And finally, one of the points that came across quite strongly was, the dangers of ultrafine particulates as well as PM2.5. But I think if we can do more quicker, then we would all be very much in support. I'll let you get on with a great Clean Air Day, and thank you for sharing.
Thank you very much, and have a good Clean Air Day. Take care.
All right, you take care. Bye-bye.
Bye-bye.
All right, I think we better leave it there, everybody, if you're happy. Did you want to say anything finally, Larissa? Because I know that we cut you off. We've got 2 minutes. Was there anything you wanted to finally say?
Just a thank you for Clean Air Day. Because honestly, while Global Action Plan coordinates the campaign, it's only the success it is because there's 300 formal supporter organisations, thousands more getting involved. #Clean Air Day is trending on Twitter, which is amazing. And all of this only happens because we come together as a movement. And that's why these crucial messages get out to people. We've got heaps of resources on the Action for Clean Air website. So do have a look there. There's stuff to help health professionals talk to patients. There's a new integrated care system, clean air framework, stuff for schools, businesses. I'll leave it there. Thank you.
Right. Okay. And can I finally say, as I said to Jo Churchill, I hope you'll be able to circulate these. There were fantastic presentations today, and I hope we'll be able to circulate those more widely, and in particular to Jo Churchill and her civil servants, Bill Parrish and others. But thank you once more, Larissa, and Stephen Holgate, of course, Mark Miller, Emilia Lim, Tom Russ, and of course Jo, as I say. Thank you all. It's been a great meeting, and look forward to seeing you all soon. You take care. I'm going to turn off now. All right, goodbye. Have a lovely clean air day.